Stop. Before you click away, if you're sick right now or someone you love is sick, the next 30 seconds will tell you whether you're wasting your money on medicine that just doesn't work. You're standing in the pharmacy cold aisle right now, aren't you? Or maybe you're sitting at home, already sick, scrolling through Amazon trying to figure out which cold medicine to buy. Here's what the drug companies hope you don't know. You're probably about to waste money on something that just doesn't work. I pulled the latest clinical research and the results shocked even me. One of the most popular decongestants on pharmacy shelves, completely ineffective. That multi-symptom combo product everyone uses, modest benefit at best, with more side effects than actual relief. I'm Dr. Zaid Fadul, and in the next 10 minutes, I'm going to show you exactly which cold medicines work, which ones are fake, and most importantly, how to know if your cold has turned into something dangerous that needs antibiotics. Stay until the end, because the final section could save you thousands on unnecessary medical bills. I'm going to reveal the one thing that prevents 70% of colds that almost nobody talks about. It's not a supplement, it's free, and it works. Let's start with the biggest waste of money in the cold aisle. Before we talk about what works, you need to understand what you're actually dealing with. Most people treat their colds wrong because they don't know the basics. The average adult catches 2 to 3 colds every year. Kids, even more. A cold is a viral infection of your upper respiratory tract, your nose, your throat, your sinuses, caused by one of over 200 different viruses. This is crucial because it means no single medicine can cure it. Here's a timeline you need to know. Symptoms usually start 1 to 3 days after exposure. By days 3 to 4, you feel absolutely terrible. That's the peak. But here's the key. Your worst day doesn't mean you need antibiotics. It means your immune system is working hard. Most colds last 7 to 10 days total. Some can linger for weeks. But that doesn't mean something's wrong. It means the virus is doing what it does. So if colds go away on their own, why are we talking about medicines at all? Because while your body fights the virus, you can feel significantly better. And that matters, especially when you have work, kids, or a life to get back to. But here's where most people go wrong. They pick up the wrong medicines. Let me show you exactly which ones are fake. This is the part drug companies don't want in this video. Phenylephrine is the decongestant in most over-the-counter cold medicines on regular pharmacy shelves. It's everywhere. CVS, Walgreens, Target. Most people use it thinking it works. It doesn't. In September 2023, an FDA advisory committee unanimously ruled that phenylephrine is ineffective for nasal congestion. Not less effective, not modest benefit, completely ineffective. Yet millions of Americans still buy it every single week, thinking it will unclog their nose. They're essentially buying a placebo. So what does work? Pseudoephedrine, i.e. Sudafed. You have to ask the pharmacist. It's usually behind the counter, not on the shelf. Why? Watch Breaking Bad to figure that one out. The key is it actually works, and the government has rules about it. You'll show your ID, they'll check it, and you're done. Here's a dosing that actually works for most people. 60 milligrams every 4 to 6 hours, maximum 240 milligrams per day. It provides rapid, significant relief of congestion. But here's the catch. If you use a nasal spray decongestant like Afrin for more than 2 to 3 days, you'll get rebound congestion that's worse than what you started with. It becomes a cycle. Use the spray, feel better for a few hours, get worse, use more spray. Don't do this. How many of you have done that before? You're not alone. But now you know better. Okay, so congestion is handled. But what about the sore throat, the headache, and body aches? This is where it gets interesting. This part is straightforward because the science is unanimous. Acetaminophen and ibuprofen work. That's it. Those are your options. Acetaminophen, Tylenol, 325 to 650 milligrams every 4 to 6 hours, maximum 3,000 milligrams per day. Don't exceed the daily max. Your liver will thank you. Ibuprofen, aka Advil or Motrin, 200 to 400 milligrams every 6 to 8 hours, maximum 1,200 milligrams per day over the counter. You can take up to 2,400 milligrams under doctor's supervision, but the OTC limit is 1,200. These work for fever, sore throat, headache, and body aches. They don't cure your cold, but they make you feel dramatically better while your immune system does the work. Check with a healthcare provider to make sure the side effects won't impact any underlying medical issues like high blood pressure, stomach ulcers, or kidney and liver disease. Here's what people get wrong. They think they need to keep the fever down all day. Actually, fever is your immune system working. You don't need to eliminate it, you just need to feel comfortable enough to rest and recover. Take these medications when you feel miserable, then let them wear off naturally. You don't need them 24/7. So we've got congestion covered and pain covered. Now let's talk about cough, and this one surprises people. I'm about to tell you something that contradicts years of marketing. The most effective thing for cough is not a pharmaceutical, it's honey, and the research is solid. You'll want to bookmark this video. When you're sick at 2 a.m., you'll thank me for putting all this in one place. Honey is more effective than placebo, and studies show it works as well as or better than some cough medications. For children over age 1, give 2.5 to 5 mLs before bedtime. This is what I give my own kids when they have a cough. No pharmaceutical company is paying me to say this. It's just what works. Never give honey to babies under 1 year. It can cause botulism, which is serious. But for anyone over 1 year, honey is safe and effective. Okay, quick poll. Drop a honey emoji in the comments if you've tried it for cough. I want to see how many of you already knew this. For cough in adults, dextromethorphan provides modest benefit. It's in most cough syrups. Look for it on the label. The dose is 10 to 20 milligrams every 4 hours or 30 milligrams every 6 to 8 hours. Here's the truth. It helps, but it doesn't eliminate cough. A cough after a cold can last weeks. That doesn't mean something's wrong. Your lungs are still clearing out mucus. Let it happen. Don't use codeine-containing cough medicines. They don't work better, and the risk of serious side effects isn't worth it. You can reach out to us at Bespoke Concierge MD for other prescription cough meds that will help you get better sleep at night. So we've covered the basics: congestion, pain, fever, and cough. But what about natural remedies? Everyone asks about these. Let me break down what actually works and what's just hype. Your friends have told you to take zinc. Your mom swears by vitamin C. Health food stores have entire aisles of cold remedies. What actually works based on clinical research? Let me be honest with you. Zinc is the only natural supplement with solid evidence for reducing cold duration. When you start zinc lozenges within 24 hours of symptom onset, you can reduce your cold by about 2 to 3 days. But, and this is important, you need at least 75 milligrams per day, divided into lozenges every 2 to 3 hours while you're awake. And you only take it for 5 to 7 days. The downside? Zinc tastes awful. Most people report nausea and a bad taste. But if you want to shorten your cold, it works. Never use zinc nasal spray. Studies show it can permanently destroy your sense of smell, and that damage is sometimes irreversible. It's not worth it. I'm going to put the exact zinc brands that work in the description below because not all zinc lozenges are created equal. Vitamin C is more complicated than people think. Taking it regularly before you get sick might reduce cold duration by about 8% in adults and 14% in children. But here's the thing people miss. Starting vitamin C after you're already sick doesn't help. So unless you're taking it daily, year-round, don't bother once symptoms start. There's a lot of hype about vitamin C, and you can check out my video linked above to get a better handle on when to use it and what it actually helps with. Honey works for cough. We already covered that. Saline rinses, safe and provide modest relief. Humidifiers, safe, help you breathe, don't shorten your cold. None of these hurt, but none of them shorten illness duration like zinc can. What doesn't work? Echinacea, elderberry, most other supplements. The research just isn't there. Save your money. I'm going to guess at least half of you spent money on supplements for colds that did nothing. How much? Share a number in the comments. I want to know how much money we're all collectively wasting on hype. Now here's a question everyone asks me. Do I need antibiotics? This is where a lot of people make a critical mistake. You do not need antibiotics for a common cold. Period. Colds are caused by viruses. Antibiotics kill bacteria. They don't touch viruses. Taking antibiotics you don't need kills good bacteria in your gut, increases antibiotic resistance in your body and the broader population. It can cause serious side effects like diarrhea and allergic reactions, and it wastes your money. The real question isn't, do I need antibiotics for my cold? It's, has my cold turned into a bacterial infection? Because sometimes it does. Here's how to know. The real question isn't, do I need antibiotics for my cold? It's, has my cold turned into a bacterial infection? Because sometimes it does. Red flag number 1, fever over 102 degrees or any fever lasting more than 3 to 4 days. This isn't normal. This is your body losing the fight. Red flag number 2, if you can't finish a sentence without taking a breath or you feel chest tightness, that's an emergency. Call your doctor or go to urgent care today. Red flag number 3, severe sinus pressure and pain that doesn't improve with over-the-counter pain relievers or gets worse. This suggests sinusitis. Red flag number 4, your symptoms get better for a day or two, then suddenly get much worse. This pattern is classic for secondary bacterial infection. Red flag number 5, coughing up green or rust-colored mucus. That's not just drainage. That's your lungs trying to tell you something. Here's the truth. I've seen patients hospitalized because they waited too long. Pneumonia doesn't mess around, especially in kids under 5 and adults over 65. If you have any of these red flags, Reach out to us at Bespoke Concierge MD. We can see you same day via telemedicine and get you treatment before it gets worse. Speaking of special populations, kids and pregnant women need completely different guidance. That's next. If you have young children, listen carefully. Most over-the-counter cold medications are not safe for young kids. For children under 4 years old, do not use combination cold medicines, decongestants, antihistamines, or cough syrups. The risks far outweigh any benefits. What is safe? Acetaminophen for fever and pain, dosed by weight. Ibuprofen for children over 6 months, also dosed by weight. Honey for cough. Children over 1 year, 2.5 to 5 milliliters before bed. Nasal saline drops and humidifiers. That's literally it. Don't give your young child combination cold medicines no matter how much the package promises. For children 4 to 12, cold medicines are still discouraged, so some products are labeled for children 6 and older. Always follow dosing instructions carefully. Never give more than the label recommends. For pregnant and breastfeeding women, acetaminophen is generally considered safe during pregnancy for fever and pain. But talk to your doctor before taking any medication while pregnant or breastfeeding, including over-the-counter products. Some supplements and natural remedies can affect your baby. Don't guess. Ask. If you have high blood pressure, heart disease, or other medical conditions, talk to your pharmacist before taking decongestants. Pseudoephedrine can raise blood pressure and heart rate. I generally recommend coricidin for these patients. First-generation antihistamines can cause confusion and urinary retention, especially in older adults. Not ideal when you're already feeling terrible. Okay, so you know what works, what's safe, and when to see a doctor. But there's one more thing people ask me constantly. Can't we just use antivirals like they do for flu and COVID? Not quite. You've heard of Tamiflu for flu, Paxlovid for COVID. Why doesn't something like that exist for the common cold? Simple answer, the common cold is caused by over 200 different viruses. Creating a single antiviral that works against all of them is nearly impossible. Flu has a handful of strains. COVID has variants, but they're similar enough for one drug to work. The common cold, it's too many different viruses. Your immune system is your antiviral. Your immune system is constantly working to protect you, but it performs best when you give it the right foundation. Start with quality sleep. Adults need 7 to 9 hours per night. Sleep is when your body produces immune cells and repairs itself at a cellular level. To get better rest, check out my tips on sleep hygiene linked above. Next up is nutrition. What you eat matters. Your immune system needs fuel, and even though you may not want to eat, good nutrition is important to support your immune system. To learn more about how food is health, you can check out my partner Dr. Edney's YouTube channel linked above. The last support for your immune system is good hydration. Keeping up on your fluid intake is really critical when you're sick, especially when you don't feel like eating. To understand ways to hydrate effectively, you can check out my video linked above. On drinking, it's important to not set up your immune system for failure. Pushing yourself to go out when you aren't feeling 100% or gutting it out at work when you should be home recovering will definitely prolong the illness. If you add alcohol to the mix, you are literally holding back your immune system from doing its job. To get a better handle on the health effects of alcohol, check out my video linked above. Now here's the thing, treating colds reactively is exhausting. What if we could prevent them from happening in the first place? That's actually possible. But first, I want to tell you about how you can get personalized medical care when you need it. You just learned what doctors know about treating colds. But here's what's missing for most people. Ongoing personalized medical guidance. Most patients see their doctor for 10 minutes when they're already sick. That's not healthcare, that's crisis management. What if you had a physician who actually knew your health history? Someone you could text when symptoms start. Someone who explains your options instead of just giving you a prescription. That's exactly what traditional healthcare doesn't offer. You're a number in a system. Your doctor sees 30 patients a day. There's no time for personalization, no time to dig into what's really going on. You're welcome to join my practice at Bespoke Concierge MD. We're here to help nationwide, offering personalized care that treats you as an individual, not a number. Whether you're dealing with recurring colds, want to optimize your immune health, or need a trusted physician who actually listens, we're here for you. Don't waste another week feeling uncertain about which medicines to take or wondering if you need to see a doctor. Thousands of patients nationwide have already made the switch from traditional healthcare to concierge medicine. They report less stress, faster care, and actually understanding their health for the first time. Visit BespokeConciergeMD.com today to learn about membership options and get personalized healthcare that actually works. But before you go, there's one more thing that matters more than treating colds. It's preventing them in the first place. Here's what most people miss. Treating a cold is the reactive approach. But what if you could actually prevent colds from happening? The science shows that specific interventions reduce your cold risk significantly. We're talking about simple, evidence-based strategies that most people don't know about. Some will surprise you. The popular ones that don't work: Others you've never even heard of, the ones that actually do work. Remember, I promise you the one thing that prevents 70% of colds, it's hand hygiene. I know that sounds boring, but here's what most people don't know. Washing your hands for 20 seconds with soap, not hand sanitizer, actual soap, removes the viral particles that cause colds. Studies show people who wash their hands 5+ times daily reduce cold risk by 70%. It's the most effective prevention strategy we have, and it costs nothing. If you found this video helpful, share this with someone who's currently buying ineffective cold medicine or who always seems to be sick. Thanks for investing the last 10 minutes into your health. If you made it to the end, comment, watched all the way, so I know this format is working. I read every single comment. I'm Dr. Zaid Fadul, and I'll see you in the next one. I made a whole video breaking down the latest science and research for what medications help prevent the common cold. You're also welcome to check out my playlist on upper respiratory tract infections linked here.